concerned with more than just providing shelter.
Yeah, there's certainly health and other issues as well. So here to talk with us about that is Dr. Ted Long, the Senior Vice President of Ambulatory Care and Population over at NYC Health and Hospitals. So Dr. Long, good to see you once again.
Thanks for having me.
So let's talk about this, right? From what you've seen, how would you describe, I guess, the general overall levels of health as the migrants arrive here in the city?
And so the first thing I wanted to say is that as we hear that the numbers of asylum seekers crossing our southern border are going down, here in New York City, everything that we're seeing is going up. In terms of the general health of migrants, what we focus on at the arrival center is we screen you for communicable diseases, for chronic diseases, and importantly for depression, because people have gone through a very traumatic journey. Our goal in New York City in terms of our approach to the health of asylum seekers is we want to, on day one, get as much done for you to get you healthy, including immunizing you or vaccinating you so that you can take the next step forward in your journey.
Yeah, so the mayor put health and hospitals in charge of the migrant emergency response and the relief. So given the huge numbers of migrants that are coming in, do you think you need more help, or are we doing okay?
So those are two great questions. We definitely need help. We need help from the federal government. We need continued help from New York State. How are we doing now, though? I am proud that we've been able to help 100,000 asylum seekers that have come to our city looking for a better life. They've come a long way, and we've had people like such as amputees, pregnant women that have made this harrowing journey through additional trauma along the way through the jungle to get here. Now that they're here, I'm proud that we're able to offer them the care that they need. But what we need is other cities across the country to do just the same thing that we've been doing for this past year in New York City. Raise your hand, help in the same way that we have. This is a global issue, and New York City is doing a great job. I'm proud we've helped 100,000 people, but we can't do it all alone.
Yeah, and that is the big ask, right? To have other people pitch in. The mayor's meeting with the federal government today, a representative from the White House, to talk more about this. But when it comes to the overall costs of the medical care that's being provided, is there an estimation on how much has already been spent?
So what the mayor announced yesterday is not specific to medical care, it's the overall care. And for example, New York City Health and Hospitals, my team operates the Arrival Center, and we operate 12 of the 13 humanitarian centers, or HERCs. Medical care is a small part of the overall cost of these sites. What the mayor announced yesterday is that if nothing else changes, we could be spending $12 billion on this global crisis helping asylum seekers coming into New York City. That's why we need help from the federal government and continued help from the state, which is helping us to open 2 of our new sites now. Specific to medical care, I will also say that we've even enrolled 13,000 people in health insurance to date. So we're doing everything that we can to draw down federal and state resources to support our city.
Yeah, something that's also been making headlines here in the city is the rise in COVID cases. So I'm curious to know, has the migrant influx actually created any kind of COVID risks in the city?
That's a good question. So as we're seeing an uptick right now in terms of COVID cases, it's something we have a laser focus on. So for every asylum seeker coming into New York City, they come into the front door of the New York City Arrival Center, and the first thing we do is screen you for communicable diseases. So if we are seeing an uptick among specifically asylum seekers for things like COVID, but also varicella or chickenpox or active tuberculosis, we'll know right away.
Are they able to receive vaccines, COVID vaccines?
Yes, they are. Thank you for asking about that. So the way our process works at the Arrival Center is as we're screening you for communicable diseases and talking to you about what are your goals? How can we do everything in our power to help you to get where you're trying to go within 24 hours? And a substantial number of people that come through the front door will leave that same front door within 24 hours, getting to where they want to go with our help. Before we were offering that help, everybody just entered into the city system. While they're waiting, we offer an array of vaccines. It's important to remember that a lot of the countries people are coming from, Venezuela, Ecuador, Colombia, not only have they not been offered vaccines like COVID, but their children haven't been offered vaccines like COVID or MMR. We fix that and vaccinate you while you're in the Arrival Center.
The other topic, I mean, as far as migrants are concerned, we've been talking about, Queens Village, they're opposing having migrants in their area. The mayor obviously saying we're out of space. So where is the city going to then now to safely house these arriving migrants? I mean, are we going to be converting parks like Randall's Island?
Yeah, so I first want to say for people that are giving us feedback about the locations that we're looking at, we very much hear you. There's no ideal or optimal place to put a very large tent-based structure that can house 1,000 or more people. But yes, we are opening one of our tent-based facilities at Creedmoor, at the former psychiatric hospital parking lot there. And we are looking to open our next site at Randall's Island a matter of days after that. What I want to say about Randall specifically is that, as you recall, we had a tent-based structure at Randall's Island back in October, so over 6 months ago. At that time, we had 15,000 asylum seekers in our system. Today, we have more than 57,000 asylum seekers in our system. What happened in the meantime was that we exhausted all other options we had for any other places where we could safely house asylum seekers, families with children, single adults. That's why we're having to create new space now. And I want to say thank you to New York State for supporting us and reimbursing us for this. This is what we need to do at this stage of the crisis.
All right. Thank you for coming on to give us that perspective. I know there's a big meeting today with the White House rep and the mayor, so we'll see if there are any federal aid or conversations come out of that. But Dr. Ted Long, appreciate you being here.
Always a pleasure. Thank you.